Welcome back to my YouTube channel. Today I'll be talking to you about congenital ptosis. Congenital ptosis. Congenital ptosis is a droopy eyelid. It is also called ptosis or blepharoptosis. This condition occurs when the muscle that lifts the eyelid is weak. Ptosis occurs when the muscle that lifts the eyelid, upper eyelid, is weak. The most common cause in children is when the levator pupillus superioris does not develop well. This type of ptosis is present at birth and is called congenital ptosis. Less common, the muscle can become weak later on in life, and when the muscle becomes weak later on in life, it is called acquired ptosis. Ptosis can involve one eye or both eyes. Marginal reflex distance is a vertical distance between the upper eyelid margin and the corneal light reflex. So this corneal light reflex is coming from the pupil. So it is primarily used to assess ptosis, which is a condition that is characterized by drooping of the upper eyelid. In a healthy eye, the MRD, the marginal reflex distance, is approximately 4 to 5 mm. 4 to 5 mm, indicating that the upper eyelid margin should rest 4 to 5 millimeter above the corneal light reflex. So distance between the upper eyelid margin is what we call MRD, marginal reflex distance. So when someone has mild ptosis, it means the droopy eyelid is about 2 mm. So it means where the cornea, where the lid is supposed to sit about 4 millimeter from the upper eyelid to the corneal reflex is sitting lower than the normal. So it means the eye is sitting, in that case, maybe the marginal reflex distance is about 2 mm. So when someone is said to have moderate ptosis, it means the droopy eyelid is about 3 mm. And when someone is said to have severe ptosis is when the droopy eyelid is 4 mm or more than that. Then the other thing that we check is the upper lid execution, which reflects the function of the levator muscle. So normally the upper lid execution is supposed to be 15 millimeter or more. When it says to be good, it has to be in the range of 12 and above. Fairly good has to be between 5 to 11 mm. When it's poor, it's when it's 4 mm or less. That is, the levator function is very poor. Vertical fissure height. This is the distance between upper and lower lid margins. Normal upper lid margin rests about 2 mm below upper limbus, and normal lid margin rests 1 mm above lower limbus. Amount of united ptosis is determined when you do comparison between the two. So like in this slide, you'd see developmental dystrophy of levator muscle, occasionally associated with weakness of superior rectus. Like in the picture that we see on top to my far right up, to my far left up, it shows unilateral or bilateral ptosis of varying severity. So there is ptosis in both eyes, but the severity is different. While in the picture to my right up, in a down gaze, ptotic eyelid is slightly higher. So we have another picture to my left down, which shows frequent absence of upper lid crease. So both eyes just look straight and they look almost like in the same fashion. So sometimes in that case, it's difficult to note because they are all sitting like in a particular fashion. While the other one, usually poor levator function, is more seen in the right eye, as compared to the left eye, but both eye are also manifesting ptosis. So this is just a picture that is trying to show the droopy eyelid in a baby who had ptosis before, and thereafter she had undergone an operation, then it was corrected. So when there is a droopy eyelid, one of the things that is seen or is manifested is that there will be astigmatism, because as the upper eyelid is not sitting on its position, it presses on the cornea. So this causes distortion, and this distortion will result in causing poor vision that can later on be translated into amblyopia, which is one of the things that we are worried about when someone is young and also they have this congenital ptosis. So when doctors are able to pinpoint the underlying cause of congenital ptosis, it may be related to one of the following conditions. It may be an injury, maybe during birthing process, maybe a neurological disorder, a muscle or neuromuscular disorder, a tumor in or around the eyelid, refractive error like nearsightedness or farsightedness. In ptosis, the upper eyelid falls to a position that is lower than normal. Severe ptosis may cover part or all of the pupil and interfere with vision, resulting into amblyopia. So poor or droopy eyelid means your eyelids drop over your eye, and this can impair your vision and lead to other complications. So there are types of ptosis. We have congenital ptosis. As we have said, this one, a child is born with it. But sometimes we can also have acquired ptosis. This one is developed later on in life, in adult life. It may occur due to levator muscle weakness, or maybe it has separated away from your eyelid. You can develop ptosis later on in life, what is known as acquired ptosis. So some of the symptoms that can be manifested when someone has ptosis is eyelid appearance. So number one, you would observe from the eyelid appearance. It may cover only the upper eyelid, or it may cover the entire pupil. Other symptoms that a patient can have are things like maybe excessive rubbing of eyes, increased tearing, decreased or visual impairment. Sometimes they will experience tiredness and achiness around their eyes. Children may tip their heads back to see. So they'll tip their heads back to see. So there are various causes of this ptosis. As I've said, ptosis cause depend on the type. Like in baby are born with ptosis is what we refer to as congenital ptosis, and those that develop ptosis later on in life is what we call or refer to as acquired ptosis. So in this case, where we are saying that the muscle, it gets weakened, so this can be due to injury or disease. Sometimes the droopy eyelid may be due to nerve damage that control the eyelid muscles. Sometimes can be other disease like Stye, Horner syndrome, myasthenia gravis, stroke, tumor, or other condition that can bring that ptosis. So most ptosis just happen with aging. As you age, the skin and the muscle of your eyelid stretch and weakens. So sometimes previous eye surgery speeds up this change because of some of the instruments that are used to keep your eye open during surgery, such as eye speculum when they're doing, let's say, cataract surgery or any other surgery that would involve the use of eye speculum. Because of that stretching, later on in life, some of the people that have gone eye surgery, they can have acquired ptosis. So if ptosis is left untreated, it could impact on vision development, and this can lead to other issues. So mild acquired ptosis is less likely to cause vision problem, and you may not need to seek treatment sometimes if it's acquired. But severe ptosis can cause serious complication if not treated in good time. So if a child has congenital ptosis, they need to be treated as soon as possible. So there are also complications with ptosis. Complication number one, if someone is left to have ptosis, they'll have astigmatism. So when your eyelid puts pressure on the front of your eye, the cornea, it can cause change. It can cause the cornea to change its shape, and this causes distortion of your vision, what we're referring to as astigmatism. Astigmatism and other refractive error can lead to what is called lazy eye amblyopia. So these are some of the complications. And the other thing is that the child can manifest with a chin up position. When they are looking at you or they're looking at the board in class, they'll be tilting their head in order for them to be able to see at a distance. So what are some of the tests that we can perform for us to be able to diagnose ptosis? Number one is observation of the droopy eyelid. If both eyelids are affected, it may be more difficult to diagnose. You also need to do some physical examination. Then if you do the examination and you find that the M1D is less than 4 to 5 mm, then you need to refer the patient to an ophthalmologist who perform additional tests and assist the patient accordingly. Some of the tests that can also be done is slit lamp examination, visual field testing to check, is it anything that may be like a tumor that is sitting in the visual pathway that is affecting the muscles that are responsible for lifting the upper eyelid, or do the ocular motility to see if all the muscles are working properly. So management of ptosis usually depend on how well the eyelid muscle is functioning. If the condition does not affect your vision and the appearance does not bother you, you might not need treatment at all if everything else is okay. So if ptosis cause problem with vision, appearance, both your eye care specialist may recommend treatment. So if it affects your vision, it affects your appearance, the specialist can recommend treatment. So the type of treatment depends on whether ptosis is caused by disease or by aging. And treatment of ptosis caused by aging usually involve surgery. Be smart, always focus.